If we decide to go ahead and do angioplasty or stenting, we use slightly different catheters which allow accommodation of wires and balloons. And the first step of that procedure is to get a wire across the vessel. This wire gives us control of the vessel, but also kind of acts like a pair of train tracks to allow other equipment to go down the vessel and be guided down the vessel, such as balloons and then later stents. Generally, with any narrowing, we do what we call pre-dilate that lesion. So take a balloon and open it up so that we have easier passage of other equipment because stents are a little bulkier. We then take a stent and put that in, and if you don't know, a stent is a slotted metal tube which has gone through multiple iterations since the early 1990s, but the stuff that we have now is really good, very trackable, and can really get to most lesions. Using a balloon, that stent is actually expanded and implanted in the wall of the artery, basically holding open that artery and creating a new lumen where the blockage or the plaque had built up before. After we're done deploying the stent, we take some more pictures, make sure that we like everything that we see, that flow in the artery is normal. Then the wires and catheters are removed. Generally, we take the catheter out of the patient's wrist or groin and either put a stitch in the artery, if in the groin's case, to sew up that hole, or put basically a little compression band on their wrist to stop the bleeding, and then the patient goes back to their room to recover.